Julie Radlauer, and I'm here today to talk to you about the science of social support. So, just to tell you a little bit about what we're going to be covering today, and we'll just kind of dive right in. But I am a researcher, and so what I really love is to teach people the why behind things, and then give them tools. And so, in this is just a 1 hour webinar, which is just a little bit of a taste about some of the tools that you can receive through, learning about the science of creating social support, both like the benefits as well as the how to do it. And then one of the workshops that Casey mentioned or showed on the screen was a 3 hour deep dive for this workshop, which is, I think, available at the end of this month, at the beginning of next month. So let me just tell you a little bit about myself. So I am a licensed mental health counselor. I am also my doctorate in public health. And so I started working in the field like blah, blah, blah. It says 25 years ago. I think that probably needs to be updated, but a while ago. And I was working in community mental health, working in child welfare, doing a lot of case management and therapy. With children and families who were struggling within our systems. And, we would, with all really good intentions, provide really valuable services. But then 3, 6, 9 months later, families would come right back into services. And I became really frustrated by that. That caused me to go back to school where I studied in public health. And if you remember from, times of COVID, public health is really about, prevention. Wear a mask and you won't get COVID, or have a vaccination and you won't get COVID. And so I really focused my efforts on how do we prevent people from getting involved within our systems? How do we prevent people from needing mental health services? How do we prevent people from getting into the child welfare systems? And that's the majority of the work that I do. I've conducted several research studies and talked to families from across the country and said, like, okay, so, are our systems working for you? And if not, like, what would work? Like, what would you want? And listening to families, what they say is they want to have their needs met, whatever their needs are, whether it's mental health, substance use, being involved in the probation system, educational needs, child welfare needs. They want their needs met in ways that speak to their culture and in ways that are more natural to us as humans, as opposed to maybe a formal treatment where you go speak with a professional in a building. They want to get their support through their family, their faith, their friends, their community. And so I became really passionate about how do we help all of the helping professionals in our field learn to do this better, because it's really hard for me to help you find friends. And frankly, I don't necessarily think it's my job. But then what ends up happening is that the service or the supports that we're offering to the people that really need it is what we have available as opposed to what they really want. And there's a disconnect there. And so I do a lot of work sharing my research and other people's research as well, trying to help us recognize, how we can do this better so that we can get better outcomes with the families that we're working with. So like I mentioned, this is just kind of like a 1 hour snippet. I'm going to try not to speak too quickly, but of course, sadly, I have a lot of information to share in a short period of time. But during our time together, we are going to understand the benefits of social support and social connection. We're also going to learn to utilize some tools to assess people's support systems as well as their connections. And then I'm going to share with you just a little sneak peek of some of the activities that you could use to enhance social supports as well as connections. And you'll actually get copies of some of those tools. So that's really what our agenda is going to be for the next, 50 minutes or so. And let's just kind of dive in. So what if I told you I had the magic formula? And if you used my magic formula, you would actually live longer. You would live 3.67 years longer if you use the magic formula. Also, using the formula creates less stress in your life, because using the formula actually releases stress-reducing hormones into your body. When you use this formula, you have better cardiovascular health and a reduced risk of death from cardiovascular disease. You don't get sick as often, right? You have better immunity, and you're actually more resistant to illness when you use the formula. A decreased risk of both substance use and mental health conditions, including anxiety and depression. You think faster on my formula, and you have better psychological and physical well-being. Does anybody want the formula? You want to? I know you want it. So what do you think the formula is? Maybe we just take a moment and if you could just kind of throw it into the chat, that would be great. Okay, I want it, I want it, I want it. I know, who doesn't want it? Um, okay, self-care, social support. Yes, yes, I want the formula. Yes, social connections, connection. Oh my gosh, you guys have the answers to the test. Yeah, exactly right. So to me, I find this as a researcher, as a scientist, I find it really interesting when people think about connections. You're like, oh yeah, but so I'll have friends and it'll make me happier. And are we aware of these physiological like things that happen in our body when we have access to connections and support? And for me, as somebody who really like responds to well, why should I do it? This is really helpful. And I think a lot of people that, the people that we work with, maybe they're not aware that there are also physical benefits to having support systems. And when we don't have the formula, when we don't use it, we actually, we have an increased risk of heart disease. It has the physical effects on our body as though we were smoking 15 cigarettes a day, even if we don't smoke cigarettes. We have an increased risk of dementia. It actually slows our brain functioning, which kind of makes sense. If you're not talking to people, it's gonna slow your brain functioning, right? It's worse for our body, physiologically speaking, than if we were experiencing obesity. And we have an increased risk of anxiety and depression when you don't have access to the formula. And so I think that, when you're trying to work with people about building supports, whether this is people that are clients of yours or even people in your own lives, because if you really think about it, there are people in our lives that we wish, spent more time with other people that maybe are experiencing isolation. Certainly, many of our elderly are experiencing isolation and don't have those support systems. And then sadly, just in the last 2 years, the number of youth who are experiencing loneliness has increased so much that it's actually more than the number of older adults that are experiencing loneliness and don't access support systems. So, I mean, it's something that's, there's a lot of research around these days. The previous Surgeon General wrote a whole advisory around the lack of social connections and how that's impacting kind of this global mental health crisis that we're experiencing. And it's not just actually in the US, it's around the world too. So it's something that we're all really need to be paying attention to. In a whole nother training, I talk about the why behind that. But here we're really just focusing on, what's the benefit of these supports and then how do we do it? So we're going to do a quick little poll. And what I would like for you to do, as the poll pops up, I want you to think about a time in your life when you were really struggling. Okay. And so this time could be related to, something that's happened to you. I don't want you to be thinking about something that's happened to, a client that you work with. I want it to be like a personal thing to you. Okay. You're not going to have to share it in the chat or anything, but just think about that time in your life when you were really struggling. And now with the poll, I want you to think about how did you get through that time? Okay, so you can answer multiple times. You don't have to select only one. But so I want you to think about, did you get through that time when you were really struggling in your life with the support of your family? How many of you got through that time when you were really struggling in your life with the support of your friends? Maybe some of you got through that time in your life when you were struggling with the support of your faith. And then some of us probably got through that time when we were struggling in our lives with the support of a paid professional with an advanced degree. Okay. And so if you could just click, what was the one thing that really helped you through the most? If it was more than one, then it's more than one. But and we'll just wait like maybe another 30 seconds or so, and then we can share some of those results so we can get a sense of how we in this room here get through some of our, our really biggest challenges.
It looks like responses are slowing down a little bit, so we can go ahead and share them if you want. Perfect.
Okay. Thank you so much. So, looking at our results together, it looks like 75% of us get through our most challenging times with our family, 66 our friends, 38 through our faith, and 35 with paid professional with advanced degree, and then 9% other. I'm always curious what the others are. But so interesting information for us. And here's the thing. When you look at the results of that poll, you see that the majority of us get through our most challenging times with our family, our faith, and our friends. And so here is kind of this rhetorical question that you don't have to answer, but I want you to think about the things that make you go, is why is it that we here on this webinar, happy, healthy, gainfully employed people who are really excited about being on this 1 hour webinar, get through our most challenging times with our family, our faith, and our friends. But then when we're working with the people that we're working with, we think that the best way that they're going to get through their most challenging times is with us, a paid professional with an advanced degree, right? And so there's lots of reasons for that. We think that we have different support systems and we really just want to help people. But in reality, at the end of the day, the majority of people want to get through their most challenging times with their family, their faith, and their friends. And so we have to ask ourselves, well, then, if that's what they really want, how do we help them? How do we make that happen for them? How do we help them become as successful as we are and not involved in our systems where they need to rely on formal supports, formal services to get the support that they actually really need? And this for me was really kind of compelling to help me really understand what I call the social influences of mental health. So the social influences focus on five science-based social aspects of our lives that we can use that will impact our level of happiness, impact our mental health. And so the social influences are social connection, social support, social capital, social media, and social inclusion, right? And so when we talk about these different influences, there's science behind how these will actually create more happiness in our life. And I'm going to share some of it with you. For example, with social connections, I already kind of mentioned that when you have connections in your life, there's research that demonstrates that you actually live longer. That's important information for us. In terms of social support, we can have up to 150 connections, which are kind of like what we call loose ties. And then we have what we call social support, which is more deep ties, right? So these are people who will be there for us during challenging times, right? So we've got the loose ties and then the deep ties, or strong ties and weak ties, whichever way you look at it. And so the science around this says that we should have anywhere from 3 to 5 strong ties, deep ties, to help us get through the most challenging times in our lives. And so one of the things that we can do when we're trying to meet with families and assess, their current situation is talks about who are their support systems, and do they have those 3 to 5? And if not, help them build those 3 to 5, because the science says you will be happier and healthier when you have that. In terms of social capital, that really refers to a sense of purpose, matter, belonging, and well-being, being part of a group. And that access to being part of that group gives you ability to network. It gives you access to further information, mentorship, many of us. So this is like maybe being part of a faith community. For many of us, it's being part of the organization where you work. Right. And so if I go to work one day and I'm like, oh gosh, I really need to figure out this insurance thing, I can ask somebody else at my work to help me through that, right? And that's social capital. It's access to somebody else so I can ask them information or get information from them, or they can teach me or show me or mentor me. And then there's social media, which is like a whole other thing. And I think we're going to be doing a social media training in the fall, but I mean in the spring. But in terms of social media, we have to learn that we can take control, take charge of what we do and what we see on social media, and impact our mental health, or we can allow the algorithm to decide how happy and healthy we're going to be. And so we have the ability, right? This is within our power, our control, to scroll or not scroll. And the way how we choose to use that tool, the tool of social media or the smartphone, impacts our mental health. And then the last social influence is social inclusion. And social inclusion really comes down to, equity for all. How can we make sure that everybody has access to all of the same, resources that they need, the same information that they need in order to support their mental health? When we are included and part of a larger group and have access to information, we have better physical and mental health outcomes. When we're excluded, we don't have, it's not necessarily equitable, and some people have better outcomes than others. Okay. So let's kind of talk about what social connections are, so I can differentiate for you between social connections and social support. So a social connection is really this kind of experience of being close to other people. It means that I'm feeling, cared for and loved and valued. And really connections is where it all starts, so I can kind of walk down the hallway and see somebody and smile at them. And that's a connection. You guys are all here on this webinar together. And if you were chatting with each other in the chat, or you saw somebody's name when they wrote something in the chat, you could, next time you see them, you could be like, oh my gosh, we were in that amazing, right? Because it's amazing training together. I remember from the social support training, right? That's a connection. Now, the difference between a connection and support is, when I'm looking for social support, it's more like help, advice. It's stable. It makes me feel like I have grounding in this world. It's emotional, it's informational, it's tangible. It's a companionship support. And there are some important values of social support, meaning that like you will be there for me. It's a mutual, reciprocal relationship. So the difference is I meet somebody online or even at my workplace and smile, say hi, wave, whatever I do. If I go and get a flat tire, that's not going to be the person I call. Right. And those are two different things. It's nice to have connections. We need to have connections. They help us understand our space in the world. And when we don't have support, we end up needing to rely on some of our formal systems to help us get through a challenging time. So they're both really important, but they serve different functions. A connection is somebody I can go and have fun with, is somebody I could quickly just like link up with. There's a research study that I absolutely love that talks about if you walking down the hallway and you smile at somebody and they smile back at you, that's great. That's a connection. Later on in the day, if you are in the elevator with that same person, there's a 74% chance that you will actually have a conversation with that person based on the fact that you smiled with each other. If you didn't smile at each other, when you go in the elevator, you will sit there and stare in a different direction, right? With a much greater likelihood, right? So these connections and this is really important. And then connections lead us to support, right? So I want you to really think about, do you have the support in your life? Think about your own personal life. Do you have those 3 to 5? Just put a pin on that, because we're going to do some activities in a little bit to kind of help kind of like guide this process. This is a survey that you can use, and you can scan the QR code, which this QR code will take you to my website. And on my website, there's information called the Social Influences Survey. And what it does is it assesses in all of those 5 areas: social connections, social support, social capital, social media, social inclusion, and really helps you kind of understand which of those areas might be a space where you need a little bit of support. And also, there should be like a link in the chat about the social support survey. So I would love for you guys to just take a moment to peek at that survey, because this survey, some of the questions, same ones are on the social influences survey. But so this survey really gives us a sense of, if you will, who are the people, like say I'm not feeling well. Who are the people that are going to show up for me? Who are the people that are going to bring me soup, right? Say I get that flat tire. Who are the people that are going to help me, deal with my tire situation, right? So we need connections in our life, but really when push comes to shove, when we don't have support, it puts us in risky situations. And that's when we need to then rely on other people and other systems to help us get through some of the really challenging times. So if you've had a chance to kind of peek at that survey, if anybody would, maybe just, put your favorite question from the survey in the chat. I love to hear which are the ones that like land with people, but I think it's important for us to know that different people look for support in different ways, and there's not a right or wrong. But this is a great questionnaire to do, say, with families the first time you're meeting them. We spend so much time talking about like, okay, so when we were hospitalized, what drugs, talk to me about, your developmental milestones. But do we ask people about like what's happening in their life, their support systems that they have?
I think we have a question. It is social media more encompassing than today's socials? I think social media was around in the 30s too, newspapers.
Hmm. That's a good question. Um, it's more encompassing, and not to be like all conspiracy theory here, but it's more encompassing, and there's science behind this, so it's not conspiracy theory because of the way that social media has really been rigged to be addictive. And there's science behind it. Just even some of the language, you get likes and you have friends, right? And so the fact that when I stop on, like I was the other time recently, I was on social media and I saw like a car accident, and I was like, oh wow. And I stopped for literally 3 seconds, like, oh my gosh, that was like shocking. Then it was like everything on my feed was car accident, car accident, car accident, car accident. Right. And so luckily for me, I know what to do in that situation, which, first of all, put the phone down. But then secondly is go and unfollow, or to then choose to follow things that bring me happiness instead of stress in my life. Right. But so the fact that the way the algorithm has been created is designed to bring us back. So when I see something that, say something political, and I'm very political, or even that car accident, or if it's something positive like puppies and kittens, right? When I see it, it brings me joy, right? And that joy, or it catches my attention if it's something negative. That what that does is it releases dopamine into my system, that whole kind of fight or flight thing. But so that releases dopamine. So every time I see something I like, it's like dopamine, ooh, dopamine, ooh, dopamine. So the more times I continue to scroll, the more dopamine that gets flooded into my system. So then eventually, hopefully sooner than later, I'm going to put the phone down. Once the dopamine clears out of my system, my body's like, I need another hit. I need more dopamine. And so then I go back to the phone because that's where I know that I'm going to get my dopamine from. Now, prior to cell phones, we received dopamine from doing things in nature or from accomplishing a really important task. Like we had to work for our dopamine. And so the fact that it's just so easily accessible, I think, is what makes our current situation of social media different than anything that's happened in the past. So really good question, a little bit of a long answer, but that's what happens when you ask a researcher questions like that. So I hope that you were able to find some questions that you liked, from the survey. See, so I'm looking at some of the questions or some of the responses. It's easier for me to seek out emotional support, which feels like an inconvenience to others, maybe because it takes time, resources, tangible costs. Yeah, you know what? It's not easy to ask for help. And I think that's one of the most challenging aspects of social support is that we feel like we're asking other people for help. Like, I don't want to put somebody out. I don't want them to have to do something for me. We're taught to be so independent. And so understanding the barriers, which I'm going to show you an activity that helps us really understand some of those barriers, will help us learn to navigate this a little bit better. Because it is important that we understand, like, why don't I have support, or why don't I ask for help when I need help? Because those are two different things. So I encourage you, take the survey the next time you're meeting with a client or a family. Just take like 5 minutes and review the survey with them and see if you find out different information than information you have already have from them. Curious to see like how you could use this information, because that tells me, okay, this person really doesn't have people in their life, and if that's the case, it now really is my responsibility to help them find people. And I'll share with you why that is. So let's for a moment talk about these social influences of mental health. Okay, so um, here I've created what's called 9 science-based elements of connection. What's important about this is for you to recognize that if you want to build support in your life, you can do it through these 9 science-based elements. Okay, and I'm going to share with you a little bit about it. You'll have access to this slide because you'll have the slide decks. But I will say, oftentimes people do a screenshot of this slide just as like a quick kind of reminder. So let's just talk about intentionality. So with intentionality, let's say I'm feeling a certain kind of lonely. I'm feeling like I don't have supports. I just did that social support survey and the answer was nobody. I have nobody for any of those things, whatever it is, right? With intentionality, I can make a change to this, right? If we put our attention towards something, we can create impact. And so say I'm like, okay, I really don't feel like I have support systems. It's been a long time since I reached out to my family. I'm going to make a phone call on Sunday to my mom. Or I'm going to text my sister 3 times per week. I'm going to reach out to my friends, even though I'm super busy with work, just to say hi and share a meme, right? Those with intentionality, I can build back up those support systems for myself, right? Another one, proximity. When it comes to proximity, the theory of proximity or the principle of proximity states that physical and psychological nearness to others tends to increase our interpersonal liking. So in essence, like the people that are near us, we can form social relationships with them but just by virtue of the fact that they are close to us. If you think about this, like your neighbor, maybe you would never know that person otherwise, but the fact that they're your neighbor, you might have sat around in your pajamas with them. Or if they needed something, you would, give it to them. If they called you for sugar or something like that, you would reach out to them. People that you work with in your office space, if you're, say, like in cubicles, by that proximity, they are your cubicle mate. If you need something, hey, I'm going to get a cup of coffee. Do you want something? Right? You just kind of naturally do that. And that's by virtue of proximity. Another way to build this support is through connectivity. And connectivity is really the energy that exists between people when you spend time together. So the more time you spend with having true connection with people, which requires your presence and getting to know that person, you can form a relationship, which eventually can turn into support systems. Then there's commonality, and this is a great way to really get your support systems. If you feel like you don't have support in your life, recognizing the things that you like to do and incorporating those into your life. So say like for example, I'm at a writing retreat right now because I really like to write. I'm in the process of writing a book. Well, I can say I like to write, but I'm in the process of writing a book. There are other people here at this writing retreat. I'm spending a lot of time with these people. At the end of the time that we spend together, we have in common writing books. We've been talking about writing books the whole time. And we will have a support system for writing books moving forward because we have this common link of reading, writing, whatnot. Another element is vulnerability. And so Brene Brown says the pathway to intimacy is vulnerability. So really getting to know people means that you have to be vulnerable with these people in order to kind of like build that support system. In our world, we always kind of have this like, well, I'm a professional. I really shouldn't be vulnerable because it requires some risk and some level of transparency. And perhaps we feel like the laws and rules of our, occupation govern how close we can be. But you don't have to give somebody your social security number. Vulnerability can be something as simple as like, oh my gosh, you like Doritos? I like Doritos too. Just by virtue of the fact that we both like the same thing, I'm willing to share something like that. Or, for example, I have children that are on the spectrum. When I'm working with clients and they have children that are on the spectrum, I will drop that little nugget into a conversation. It's like, oh yeah, you know what? My son's on the spectrum and da 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 da. Not making it about me, but letting them know, hey, I understand from a different space what you're going through, and also opening the door of if you want to ask me questions about it, I'm here. I'm happy to talk about it. right? Now, am I going to sit there and talk to them all about my child's diagnosis and whatnot? Probably not. But I will be happy to share tips that I've learned along the way or parts of my journey, which will help us build more of a relationship. Another one is dependability. Dependability is actually a really important one, especially for the young people that we work with, because their definition of dependability and our definition of dependability are kind of two different things these days. So teaching people about dependability and how you won't really have support systems if you don't show up for your support systems, right? And so that is a very, like we both have to be in on this commitment together. Which brings me to reciprocity, which is not if I do something nice for you, you should do something nice for me. But the theory of reciprocity really says that when I do something nice for you, there's a much greater likelihood that you're going to do something nice for me. And so that helps us kind of build those systems when we're thinking about that. Now, don't do something nice for somebody so they do something nice for you. But if I'm sitting at home and feeling kind of lonely or isolated or anxious or depressed, and then I reach out to somebody who's moving and I say, hey, you know what? I'm just sitting around. Do you want some help? Right. So then I go and I help them. There's a much greater likelihood that in the future, if I need something, that person will be there for me. And that's the theory of reciprocity. Then there's flexibility. And so flexibility is one of the biggest challenges when it comes to connection support these days. Because if you haven't noticed, we're somewhat polarized in our thinking these days. And so when I'm inflexible, I break relationships. Right. If you think about some of the people in your life that maybe you used to be close with, they have different views than you. We don't talk that much anymore, right? And so that inflexibility has broken some of our support systems. And there's research that, in the 1990s, we had 4 deep ties, those strong ties, and now we're at about 2. And some of the speculation is because we have become more and more polarized. And then the last element is around positivity. And so it just makes a lot of sense. When you're more positive, people are more drawn to you. You're more likely to, build support systems and have connection in your life. So how do we help build support and connection? Like, what are the things that we can actually do about it? I think that's really important, like the tangible techniques. So here's one. When we're trying to find common ground, right? So starting a conversation with a client, just taking time to talk about what we would consider perhaps frivolous things like, I like Doritos, you like Doritos, right? What do you watch on television or YouTube, or who do you follow on social? What does a typical Saturday night look like for you, or a Saturday day look like for you? What do you do in your free time? Trying to understand the things that they watch, but really what you're looking for are the things that are in common. So if I like a particular, I follow somebody on social media and then they mention that they do, instant connection, right? And we can talk about that. Or if I like a particular topic, but I'm not, they have access or they've been watching an influencer in that space, then they're sharing information with me. We have it in common. And so intentionally looking for commonalities with people is a great way to begin to develop support systems when we don't have support systems. And so I always encourage people, the first time you're meeting, don't just dive deep into like all of the biopsychosocial questions that we're trying to ask. Start with some of this. And then I will often, like if I like Doritos and they like Doritos, next time I come, I'm bringing a bag of Doritos. It's $1, but what it does is it helps begin to kind of seal the deal with our engagement, because who doesn't like a free bag of chips, right? So let's use this tool. This is a tool called an ecogram, and I think we're going to put it into this tool into the chat. You don't actually need the tool to do this. You can literally have a blank piece of paper and just draw circles. It won't be as pretty with all the rainbow colors, but so the way that I like to use this tool is in the center. I might write, like in that kind of lime green section, I might write, say I'm feeling lonely or isolated, or I don't feel like I have friends, or my family is really distanced from me, whatever it is, whatever's lacking really is going to go in that lime green circle in the middle, right? So Julie is feeling like she doesn't have support system, or she doesn't have friends. So then each of those colored circles, like the red circle, this could represent, say, like school. The orange could represent home. The yellow could represent, work, or could represent extended family. The green could represent your neighborhood. The blue could represent your faith community, right? So each one represents a different domain. And so what I would say is, okay, so Julie, when you're at school, in this red circle here, and you're feeling, lonely, isolated, anxious, depressed, like, who would you talk to? Right. And I might say, like, oh, I could talk to my math teacher, or oh, I would talk to the guidance counselor or the school counselor, or oh, I might reach out to a friend, or I might say, nobody, I would not talk to anybody at school. Then you go to the orange and you go, okay, so when you're at home, where you live, if you're feeling lonely, isolated, anxious, depressed, who would you talk to? And I might say, mom, I might say my dog, I might say, there's nobody in my house that understands me. I would not talk to my family. You could go to the yellow and say, okay, extended family, aunts, uncles, cousins, people that don't live with you in your house, but are still family. If you're feeling a certain kind of lonely, isolated, well, who would you talk to? And they might say, oh, my aunt, oh, my grandma, oh, in my family, we do not discuss things like that. Then you can go to green and say, okay, in your neighborhood, if you're feeling kind of lonely or isolated, is there somebody in your neighborhood you would talk to? It's like, oh, yeah, I have a friend that lives 2 doors down or 3 blocks over, or I'm from Florida. In Florida, we don't really know our neighbors until there's a hurricane. So I'd be like, nope, nope, nobody. Then blue could represent your faith community. So you go to your faith community. Is there somebody you're feeling a certain kind of way? Who would you talk to? And I might say, yeah, the youth pastor, or, my family also goes. So I might talk to one of my cousins who's my age, or I might say, no, in my faith, we do not discuss things like mental health or how I'm feeling. And then at work, right? And so I'm not going to go all the way around, but these are all the different domains. When you do an activity like this, you're going to find out one of two things. You're going to find out either one, the people that you're talking to actually do have support. They have support in all these different spaces in their lives, but they don't know how to ask for help. They're not comfortable asking for help when they need it. That's a skill set that we're going to work on with that person. The other thing you might find is that everywhere they go, they don't feel like they could talk to somebody. They go to school, they can't talk to somebody at home, in their neighborhood, with their family, in their faith. How would you feel if everywhere you went, you did not have somebody you could talk to about what's bothering you? How would that make you feel? Lonely, isolated, anxious, depressed. Like you would feel the way that you're feeling. But in our world, we say, oh, well, you need to go talk to a therapist. But in reality, do you? Because if I had connections and support in these spaces, I probably wouldn't need that therapist. I would feel more supported in my life, right?
Alrighty, we have one question. It's back to those surveys. And Andrea or Andrea, I'm sorry if I said your name wrong, asked, do you have a youth survey?
So the social support survey that we use comes from, for youth, comes from Youth Thrive. I don't know if you're familiar with that survey tool.
I will find it.
Yeah. So yeah, Youth Thrive. It focuses on connection, but some of the questions are about support too, and it's specifically designed for youth. And I believe it's open access, like anybody can have access to it. Thank you. Okay, so I encourage you to use this tool. What we really want is we want to make sure that we assess with people, where do they have support, and if not, like why not? And then what do we do to help build it? So remember I said to you before, like, okay, the people that we work with, they don't have friends. It's not really my job to help people find friends. I think after you do an activity like this, you kind of realize that, like, no, it's not my job to help somebody find friends. But if my role is to help this person, um, with their mental health, or be more successful in school, or complete the tasks of their probation, whatever my role is with the young people and families that we're working with, if they don't have support systems in any of those spaces, they won't be successful. And so helping them create those support systems and that access to social support will help them get through their challenging times in every domain. And so it is actually our job to help people find those support systems. And it should be, when I talk to people about like writing, individualized service plans or treatment plans, I always say, where's your support goal? There has to be a social support goal on every, like that we're focusing specifically on this. Because if somebody's involved in our systems, they need some help with their support systems. Right? And so that's something that we can do. Um, Another tool that I want to share with you is a really fun activity for anybody who does groups. And again, all of these tools, I'm just like a really quick overview. We're doing a 3-hour workshop where we're going to do a deep dive and really get into some of these tools and practice them with each other in breakout rooms and things like that. So, but I wanted to just share some of the tools for different activities and disciplines that you guys work on. This is a great one for groups. You can also do it individually. When you're working with somebody who, realizes or recognizes that they don't have those support systems, then give them the assignment. Hey, before next week, I want you to find a bingo. It can be a cross, it could be down, it could be a T, whatever you decide. Just have whatever their favorite snack is as, what they get for winning when they've done their task when they bring it back the following week. But getting them to begin to do some of these things for people who are lonely, isolated, anxious, depressed, that's they're going to be on their way to building supports. And I think that that's what's really important is we want to help give people tools so they feel more comfortable and able to do this stuff. And it doesn't have to be like big things. Like, for example, one of them is wave to your neighbor. You're like, well, how is that going to help build a support? Well, let me tell you a story. During COVID, I travel a lot these days, not quite as much because of this virtual, opportunity or space, but I travel a lot for work and do a lot of public speaking and all over the country. And so when COVID happened, my whole world shut down, as did many people's worlds, right? And so for me, that was a bit of a struggle, but I really had to set a routine for myself so that I wouldn't get really depressed because all of a sudden I was like at home with my 3 kids who were all now at home doing school from home 24/7. There was a lot of togetherness and with 3 teenage boys. And so part of my routine was to get up and walk every day. Now, mind you, I had lived in this neighborhood for 20 years. I've lived in the same house, my whole marriage. And so I got up early because I wake up early. It's like 5 o'clock in the morning and I'm walking around the block. And I noticed that there's another woman who was just as ridiculous as me up at 5 o'clock in the morning. And it started off where we would just like see each other and wave. And we'd be walking in opposite directions and we'd wave. And then we started like, one of us decided to turn around and we would walk 6 feet apart, each on one side of the street. And we would walk around the block and kind of like talk, even though it was 5 something in the morning, we'd be talking to each other. Then it's turned into texting, like, hey, I'm going out in 5 minutes. Okay, I'll meet you at the mailbox, whatever it was. And we began to communicate that way about when to walk. Then we started saying like, okay, hey, what are you doing on Saturday? Do you want to go to the park and walk together? That has turned into such an amazing friendship. Remember, I lived in the same space for 20 years before that happened, more than 20 years before that happened. And now I have a really close supportive friend who like takes care of my animals when I'm out of town. I do the same for her. Like we have a really good relationship, but it started from waving. Right. And so when people say, well, I don't understand how this is going to help me, it's the beginning, right? You have to start somewhere. And for some people, just waving is more than they're capable of right now. So encouraging them to do that, that's the beginning of the process, right? And so it's our responsibility to make it as easy for people as possible, I think. So here's another activity. This one's specific to building support systems. And this one is about like kind of my 5. And many of you probably already have it. What I want you to do is assess with the families that you work with, whether or not they have it. Okay. And the reason for that is because you would in your texting stream, whether it's you use like, WhatsApp or, just regular texting or, there's lots of different, Snapchat, whatever it is, right? But creating text groups. And I want you to be very specific about creating one group that if you needed something, that these people would be here for you. Whether it's I'm running late, can you pick my kids up from school? Whether it's, I'm going out of town, can you help me with the dog? Whatever those things are that you really like need people for, to create this in a virtual platform. Because when it's already created in a virtual platform, when I need something, I don't actually even really have to ask for it. I could just pop it in that chat. It makes it so much easier for people who are struggling with asking for help, creating this mechanism, and really literally started it off by saying, like, I'm creating this support or this chat for support. When any of us needs anything, let's put it in the chat together. You guys in this chat right here, you are my five. Like, you are the people that I, feel honored or blessed to have in my life, and I'm counting on you for support. And I hope you can count on me too. I want you to know you can count on me too, right? When you do something like that, you've created the mechanism to ask for help moving forward. It just makes that process happen so much easier when you've got the mechanism of a group chat already created. So encourage the people that you work with to create something like that when they're struggling for asking for help. So as we're winding down, I just want to read this quote to you, and I'm going to read it twice so that you the first time it doesn't necessarily sink in. So a person in need of support looks a lot more like a person in need of treatment than a person that has support. So let me read it one more time. A person in need of support looks a lot more like a person in need of treatments than a person that has support. And so if we're trying to support the people or be there for the people or help the people that we're working with, um, not need our services as much, we have to help them build support systems so that they don't need access to treatment. Right. And the last thing that we're going to do is I'm just going to ask you to think about somebody in your life that you feel is a support to you, and just send them a quick text. Just thinking about you, wanted to say how grateful I am to have you in my life, or I'm in this amazing training and the trainer just assigned me to do this, whatever you want to say. But just take a moment to connect with somebody who is your supports and say thank you for what they do. And then we will excitedly get amazing texts back, which I just absolutely always love to hear the texts back that everybody gets. Question. So speaking of connecting and supporting, I wanted to share with you my info. So you have it there with the QR code.
Julie, it's so funny that you mentioned texting people for support. I just recently, I'm a military spouse, so I move all over. And my cousin, we call each other Fuzzin because she's 8 months younger than I am. And even if we weren't cousins, we would still be friends. And so we made that up when we were about 8 years old. And she is my absolute support system. And we were just texting a couple of days ago about how thankful we were for everyone. For her and I, and then for our family, but specifically for her and I, and just being there, how important and that connection has been for us. So, what a great
Thank you for
timing.
sharing. Thank
Yeah,
you for sharing.
absolutely. So, as you guys can see, you can take a picture if you want to of this slide that Julie has up. There's that QR code in the top right. And then on this next slide, all we have just a few things for you. So we have the survey that Lana can drop in the chat for you. This is the survey that will take you through to kind of give your feedback about us today, and then also to receive your certificate of attendance. So you can find that there in the chat that Lana just dropped, sorry. And then we have your follow-up email with resources that'll go out in 2 days. But since we still have a few more minutes, I just wanted to go ahead and drop that link in the chat for you. If you have any questions, please feel free to drop them in the Q&A. And then also, while we're still sitting here waiting, oh, Lana, you just read my mind. She put our upcoming trainings link in the chat. Wow, she beat me to it. So there's our upcoming trainings for you. We have a protective factors training, the Strengthening Families Framework. That's coming up on September 16th. I will be facilitating that, where we talk more about social connections and building those, and some resources we can access as well. And then, of course, we have Julie's training at the end of the month. And so I'll make sure while we're sitting here to find those links and put them in the chat for you. But if you have any questions, we'll hang out for a few more minutes and you can drop those links in those questions in the Q&A pod.
Thank you so much. I really enjoyed our time together.
Yes, thank you so much, Julie, for this wonderful training and then all of the resources. We love when we can be able to provide take home or action items for our participants, and you always do that. So, you have wonderful messages coming up in the chat, so I don't want you to miss the thank yous that are in there. I
Thank
dropped the
you.
link in the chat for the Social Connections Protective Factor webinar coming up on September 15th, 16th, where you get to hear my voice for 3 hours or two
Ah,
hours. And then I will find the link as well for Julie's next training for you all.
thank you. Thank you. Have a great weekend, everybody.
Yes, it is Friday. I hope you all have a great weekend. And so we'll hang out just for a few more minutes if there's any last minute questions. But if not, thank you for joining today and keep an eye on the chat to find your links. And then Lana, if you could drop the link again for the survey, just so that way they have it one more time. Alrighty, well, it looks like we don't have any more questions. I dropped those things for you in the chat. So we will go ahead and close out. I wanted to thank you all for joining us on this Friday, taking an hour out of your day to spend with us. And I hope that we get to see you in Julie's next training on September 30th. So we will see you then and have a great weekend. We will go ahead and close out.
Hey, thank you.